first is I want to clear away some of this connective tissue so that you can see its poor little wimpy muscles. This poor cat. People need to feed their cats. Or not.
You should tell me what the hell.
It's like it's not even preserved. It's so gross. Okay, so what we want to do first of all is look for the leg muscles that I couldn't remember and I still can't remember to this day. So you have some hamstring and you have some quadriceps muscle. So this first muscle on the inside, this is called the sartorius. And then this muscle across the bottom part here, you can dig in there. This is the gracilis muscle. I put a hole in it, sorry.
She'll be alright.
You think it'll be okay? I'm scared.
She's already pretty far from the base.
Okay. So what I'm going to do is I'm going to cut and reflect those. Oh my God, this is so thin. All right, so I'm going to cut the sartorius first and reflect it back so that I can see this muscle right here, which is called the quadriceps femoris. Okay, this muscle right here is quadriceps femoris. And then I'm going to cut through the gracilis muscle, which is a little less wimpy. And I'm going to reveal one, two, three, four. This muscle is the adductor, longus. This muscle is the adductor magnus. And this one here is called the semimembranosus. And then along the bottom here, this is called the semitendinosus. If we flip it over, we notice that it's this whole big muscle group that makes up the hamstring group. Okay, so here's the semitendinosus. Or wait a minute, sorry. Shh. I didn't make that mistake. I have a sugar. I'm having a sugar low. Okay, so here, let's do this again. I'm sorry. Adductor longus, adductor magnus, semimembranosus. This muscle, semitendinosus, and there it is. Okay, semitendinosus is mostly on that side, but we can see it right there. This right here is called the biceps femoris. Okay, biceps femoris, semitendinosus, semimembranosus, adductor longus, adductor magnus, adductor longus, gracilis, sartorius. Okay. Now, if you look at the arm here, you have a couple of triceps muscles.
Tricep, tricep, awesome.
Yeah. Okay, there should be a group of two of them that are pretty easy to see. Here's your triceps brachii long head, and this is the triceps brachii lateral head. Right here. And then this big one, not really in this kitty. He's like all connective tissue, no muscle whatsoever. Poor cat. I can't even tell. All right, but the biceps muscle, biceps brachii, is right here. Okay, this one on top, what's this? Goes from here to here. Clavotrapezius. What about from here to here? Clavodeltoid. Okay, good.
Where's that one, the bicep one?
The biceps, is right under the clavodeltoid, right here. So where your biceps are, right here, that's where his is too. Okay, so now I'm going to cut this poor kitty. I would start at the abdomen and start a little off to one side. I don't know why I have hindering for the right side. Okay, and you're going to have to cut up through ribs. So just be a little careful. It's not going to be that easy. All right. And so make your incision, and then you want to come up here to the neck area, and you're going to use your blunt probe, even if you don't have a wimpy kitty like this, and start clearing away these neck muscles. Okay, and that's going to reveal this. What's that? Trachea. Okay, and then if you look just dorsal to the trachea, you should find a tube that does not have C cartilages in it. That's this tube right here. Anybody have a guess? Esophagus. Yes. Okay. So now what you want to do is you're going to take a scissors and you're going to start opening up your cat. And what you're going to notice is that there's this big muscle that divides the thoracic or chest cavity from the abdominal cavity. That's the diaphragm. And you're going to cut and follow it along the body wall. Okay, and that's going to open up this cavity. I would make a terrible surgeon because like I have to turn the whole body around to cut it because I'm so right-handed. Yeah, I'll show you on this one, you guys. Actually, Shauna, did you guys put your kitty away?
Yeah.
Oh, okay, no worries. All right, so
Sorry.
that's okay. So several things. First of all, when I open up this chest cavity, look at, ugh. Good thing I'm wearing glasses, but like they're falling down my nose, so I just got a nice shower of Carolina Preserve Perfect in my eye. So you want to, these don't snap very well, but you really want to snap the ribs so that you can, oh, they do snap well, so that you can bend the tissues back.
Yeah, I'm rethinking that.
Sorry. Don't do it. You don't want that responsibility. Are you kidding me? All right. Be a grad student and you don't have any responsibility. Okay. So we want to try to preserve. These are beautifully injected. Exactly. And there wasn't even like they didn't do an incision down here because it was so small. All right. So a few things you're going to notice. First of all, there's this thing here. These are the lungs, only one side. We see the diaphragm here. And the diaphragm forms like a closed cavity between the abdomen and the thoracic area because when the diaphragm contracts, it pulls down and creates negative pressure in the chest area that will fill the lungs. Okay, so you guys have seen those. Yeah. So you guys have seen those TV shows where they're like tension pneumo, gunshot wound to the chest. That's when the lungs can't inflate because there's compromise to the pressure in the thoracic cavity. So I'm going to cut this artery and this vein here. These are the internal mammary arteries and veins. Okay, so they're going to the chest cavity where they feed the mammary glands. Just go into something where you don't have to break bones.
It just sounds.
Okay. All right. So one thing that I don't see that I saw very clearly on the other cat was their greater omentum was covering the organs. Since this cat's very skinny, I doubt that its greater omentum is anything to be happy about. It's this right here.
It's not
See?
great.
It's not great. It is not great at all. Has anybody opened their cat's abdominal cavity and it has a really nice greater omentum that we can see? Anyone? Bueller. Like bigger than this? See? Look at how wimpy this is. This poor cat was starving to death. So this abdominal fat is there for a good reason. So you guys look at, will you guys look at their greater omentum? Oh, here. Sorry, Savannah. Jan, can you watch out for a second, please? Oh, yeah, see there, that's a great omentum. It is indeed great. You know, like you prefer your ER rough. Rough ER, yeah. Okay, this is not a greater omentum. Okay, so somewhere in this greater omentum there's a hole or an opening because the greater omentum is a bag. It's not just one single membrane, but it's a bag. And it usually covers the intestines. Serves as a way to insulate the intestines so they can do their work. Okay, some people have a greater omentum than others. But it serves a purpose, and that bag has an entrance to it. There's an opening to the greater omentum, and it occurs on the dorsal side of the greater omentum somewhere in this area near the pancreas. And that opening is number 34 on the exam, always, and it's called the epibloic foramen of Winslow. Okay? Don't forget it. If you spell it wrong because it's going to be on the board, then I take 1,000,000 points off. Okay, so the epibloic foramen of Winslow is the opening to the greater omentum. It's usually on the other side by the pancreas, which is I'll show you in a minute. One thing you should know is at the area where the diaphragm and the liver connect, there's a membrane here that's called the falciform ligament. And sorry, I was trying to remember it. And then we see in between these two lateral lobes of the liver, there's your gallbladder. Okay, so if I lift up the gallbladder, it does. What we want to do is find the ducts that connect the liver to the small intestine. So the liver secretes bile, and the gallbladder stores the bile. And it is for digestion of fats. And the bile gets to the small intestine via two different ducts. So there's bile coming directly from the liver, and then there's bile that comes from the gallbladder that's stored there. Okay. And if I can find it, it was so easy in the other one. It seems to be giving me problems. So these ducts form a Y. So here's our gallbladder. There's a duct coming directly from the gallbladder. This is called the cystic duct, because if you think of the gallbladder as like a cyst on the liver, that's the cystic duct. There's a duct that comes from the liver itself. So this is that duct. That's called the hepatic duct. Okay, so there's the cystic duct, the hepatic duct, and then they join together and enter into the small intestine right here in the common bile duct. Okay, cystic, hepatic, common bile, and then they enter into the small intestine. Okay, so here's the liver, or not the liver, sorry, the stomach. It has a greater curvature to which the greater omentum is attached. And then it has this lesser curvature in here, and this poor guy has this wimpy little lesser curvature of the stomach with this little membrane in here. This is the lesser omentum. On the greater curvature of the stomach is this organ here. This is the spleen. Okay, it's really ugly. Now this poor guy, I can see he's got a lobe of his pancreas that sticks out here. If we follow the stomach around and find where the common bile duct goes into the small intestine, that area right there, see there's this little pinch right here? That's the pyloric sphincter. And the common bile duct enters the small intestine right behind the pyloric sphincter. Okay, so what digestive organ is associated with where the pyloric sphincter is? Pancreas. Okay, so look here. The small intestine is right after this pyloric sphincter, and the duodenum of the small intestine is this first part that curves like this and goes straight down. And in the membrane of where that duodenum is, do you see this chunky little thing right here? This is the pancreas.
It's
Okay.
kind of like a pigeon.
Huh?
Kind of like a pigeon, right?
Yeah, exactly. So that's the duodenum. If we follow the duodenum here, we see that the intestines get all curly. Okay, and we know that there are three parts to the small intestine: the duodenum, the jejunum, and the ileum. So right after this duodenum takes a downturn straight, it'll start to curl. This is where the jejunum starts. Okay, I don't know where the jejunum ends and the ileum starts, but I know that this whole curvy part of the small intestine is both the jejunum and the ileum. In the mesentery proper, the mesentery that's within the jejunum and the ileum, there are mesenteric arteries and veins, or intestinal arteries and veins. And at the center, there's this group of lymph nodes here. This group of lymph nodes is called the pancreas ocelli. And it's one of the areas where those nutritive secretions that are coming through the intestinal arteries and veins are filtered. Okay, so it tries to kill all the germs. Okay, so this intestine winds around and around, and then finally it joins this large body right here. Okay, so see, this is the end of the small intestine. This is the large intestine. See the difference in diameter of the tubes. Also at this junction, there's this blind end sac right here called the colic cecum. In us, we call it the appendix. Okay, so this is where the ileum ends and the large intestine starts, right here at this colic cecum. And in the cat, this large intestine lies in the belly so that there's a small ascending part, there's a transverse part, and then there is a descending part. Okay, so there's an ascending colon, which is very small, a transverse colon, and then a descending colon. When the colon disappears behind the pubic symphysis, or these hip bones here, it becomes the rectum. This is a poor little female. Okay, I can tell because there's one uterine horn right here, and see this little yellowish bead right here? That's an ovary, uterine horn. And cats have a bicornate uterus, has two horns. Here's the other side with the ovary right there. And just in front of it, I hope I didn't cut it, should be a urinary bladder somewhere. This poor cat, it's like, here's the urinary bladder. Look how tiny it is. In Shauna's cat, it was like this big. I think the bladder itself was bigger than the entire cat, this entire cat. Okay, so here's the urinary bladder. Here's your descending colon, right uterine horn, left uterine horn. Oh, we got to dig out a kidney. Okay, so finally we have an animal where the kidney looks like a kidney. And if you go to the dorsal body wall and start picking through the mesentery, so in a normal cat, that mesentery that hides this kidney would be filled with fat. This cat has none of that. Okay, so dig out a kidney. All right, this is what the kidney looks like. All right, and you can see, yay! A little latex accident here. It looks like some of the latex crossed over. So this would be your renal artery. This, what should be blue, is a renal vein. And then you can see up here, there's, see this pink artery that comes out to here, and then this blue vein that's coming from that area over to here. This is where you would find the adrenal gland. And I bet this little bunch of brown tissue right here is the adrenal gland. Couldn't find it on the other one. But what you should do is, once you find the kidney, is cut it in half so that you can identify the different parts. So if you can see on this kidney, the outer edge of it is pink. On this kidney, on the other kidney it wasn't pink. But this outer edge is called the cortex, and then this smooth area right here is the medulla. So the cortex is where a lot of the filtration takes place. The medulla is where the concentration of urine takes place, and everything gets collected in this area here, which is called the hylux. Here, not to be convinced with the big toe of the bird, which is the hallux. Okay, so cortex, medulla, hylux. All right, we're going to do arteries and veins next week, but that's about it. Oh, you want to, boy, this poor cat doesn't even have, there's a bunch of lymphatic tissue that will help fight infection in the thoracic cavity, and usually you find it all over this area right here. That's called thymus tissue. There's a good picture in your lab manual, and then somebody who has a normal sized cat should have good thymus gland. But this membrane here, this is called the pericardium. You want to strip it away from the heart. You can cut into it and take most of it away so that you can see the heart. We're going to talk about the heart next week, and the vessels we're going to do in the following 2 weeks. Okay, so here, see this chunky stuff right here? This is all thymus gland. All right, and that should help fight infection in the thoracic cavity. So see if you can identify some of that, and that's about it. So you can see, here's the heart. I know we'll talk about this next week, but here's the right atrium, the left atrium. These are the two ventricles. You can see the vasa vasorum. This would be the one of the coronary arteries. I think it's the left anterior descending, the widowmaker. And then this big vessel right here that's coming across is the aorta. And we're going to see next week where the aorta goes. All right? Mm-hmm. Yay!